Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about female empowerment. And before I get into it, the first thing I want to make very clear is that I am not giving any type of medical advice. So if you have any medical issues, please see your healthcare provider. And if you are having any religious issues, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am very excited to have on with me today Dr. Ude. Dr. Ude, welcome. Welcome to the podcast.
Thank you. Thank you so much.
Yes, we're happy to have you. And so please, for all of our listeners and guests that may not know who you are, please introduce yourself and let us know what you do.
Yes. So thank you so much for having me. This is really exciting and fun. So for those that don't know me, my name is Dr. Ude. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine. I also own an aesthetic practice. And with both, my goal is to have my patients feeling good and looking good.
Awesome. That is awesome. I like that. So I know that today's topic is on female empowerment and having your patients, like you just said, feeling good on the inside and also on the outside. So what exactly does that mean for you and in your practice?
Yeah, so a lot of the times when you hear about things like self-care and taking care of yourself, what I find, and I had the same thing, I was doing the same thing. I find that people focus a lot more on the physical. So for me, when I think of it, it's mind, body, and soul. So most of the things you hear about, things which are great, things like massages or, going on vacation. So a lot of things that that gets talked about a lot is more the physical stuff. And so what I try to do is also make sure that, the other parts of it. So mind, body, and soul. So feeding your mind and also even feeding your soul and spirit is also taken into account.
Okay, awesome. And so I know that you are a family practitioner and your patients, you have a lot of things that you take care of.
Absolutely.
From what they say, the cradle to the grave, right? Family practitioners, they take care of everything. So tell me, I'm really interested, since this is the Muslim Sex Podcast, I'm interested in what type of sexual health topics that patients usually come to you for. And is it usually women or is it men or is it like a combination of both?
So just like you said, I do see newborns all the way up to, geriatrics. And so I see all of it. So, I have obviously women coming to me, either complaining about, either, pain with intercourse or, vaginal dryness or decreased libido or sex drive, to men who come in with erectile dysfunction issues or, more social issues, maybe not, feeling, performance issues. And a lot of that can be psychosocial, not having time to spend with their partners. So, I mean, because we're kind of the first line and we see patients for whatever issue is coming up, we pretty much see all of it.
Right, right. So I know that you had mentioned like decreased arousal, decreased
Yes.
libido, and pain with intercourse and things like that. So typically, how do you, what do you suggest that somebody then do then when they have those issues?
So, I mean, because I take care of a whole bunch of things, a lot of the times I will take care of what I can, and then I do refer them out. So, for on the male side of things, if it's things like erectile dysfunction, first of all, it's figuring out the reason why that's happening. So, if it's more of a psychosocial issue, really busy, or there's some anxiety or depression, or so, then I try to help with those things, either with therapy or with medication, depending on what the patient wants. Versus, is it an anatomical issue? Now, if they are having things like structurally, they're still able to have an erection and maintain an erection. It's just they're able to attain it, but they're not able to maintain. Then it's obviously medication. But a lot of times I will refer out to our urology counterparts going forward. On the women's side of things, with painful intercourse, then usually it's things like doing a physical exam, figuring out what's going on. Is there an infection? Is there an anatomical issue going on? If it's a psychosocial thing, again, taking a good history, figuring out what's going on. And a lot of times, some of these issues can be easily teased apart and figured out. And so sometimes it's, either counseling or something easy that we can just talk about, all the way up to medication, or, referring out to our specialist counterparts as well.
Sure, sure.
Yeah.
So, I often will get patients that come to me for things such as vaginismus, right?
Mhm, absolutely.
And so I'm wondering if you also see that in your practice, and, what are the things that you offer to your patients regarding vaginismus?
So with vaginismus, which is painful intercourse, again, if it's a lot of psychosocial, where they've had trauma and things like that, then some of it I will discuss with them. A
Right.
lot of the times I find that by the time they mention that to me, they need a little bit extra. So I will get
Yeah.
some help from either our psychiatrist friends, or have them see OB-GYN as well. But
Right.
yeah, sometimes if they've had traumas, then we talk about that. So yes.
Yeah, absolutely. I find that one of the most helpful things for women that have vaginismus, like you mentioned, it's definitely pain, but oftentimes women are, they experience fear, and the muscles around the vagina will just contract, right? Even in anticipation of like a pelvic exam, of a tampon insertion, of anything penetrative going inside. And so oftentimes, I agree with you. There needs to be a lot of coaching, a lot of working with thoughts, a lot of working with, the fear. And definitely, like you stated, sometimes it can happen as a result of trauma.
Absolutely.
And or things maybe that they have heard and have then internalized.
Mhm.
And so oftentimes that takes the form of coaching or counseling, as you
Yeah.
were saying. And oftentimes I find that pelvic floor therapists definitely help as well, right, when they work with the dilators for patients with this type of issue, and then slowly working up to where they are able to tolerate like an exam and things like
Absolutely.
that. So I think that often that takes a lot of counseling and coaching and things like that when it comes to vaginismus. So you had mentioned that you also see men in the practice, and you deal with like erectile dysfunction and perhaps premature ejaculation. So usually do you do like the workup and then you refer out? Is that how it works then?
So yes, I do both. So a lot of times I'll check and make sure that there isn't an infection going on. Get a good history, obviously, and then also asking those questions about whether the issue is, attaining it, maintaining it, how long has it been going on for.
Right.
Obviously, making sure that they're not on medication that is going to interact with what I would prescribe to help with um, uh, maintaining an erection or attaining. The other thing is even the comorbid conditions that are associated.
Oh,
So,
yes.
yeah, a big
Hmm.
one is diabetes. So a lot of
Yes.
times that's associated with, coronary artery disease or even just
Yes.
atherosclerosis, which is what leads to a lot of this. And so
Right.
I'm checking, towards that. And then sometimes we have situations where it's, so severe if they're not able to attain an erection at all, then usually there's a lot of anatomical and structural problems, and then that's usually they need to be referred out. But a lot of the times, I can prescribe medicine that will help them along as well.
Right. What you mentioned about like, comorbid symptoms and things, other things going on in the individual, right? So
Yes.
I had a urologist on who mentioned that, one of the biggest things for erectile dysfunction is coronary artery disease, like what you had stated.
Hmm.
So, if somebody is having issues with erectile dysfunction, one of the things that they will do is actually refer the patient to a cardiologist
Hmm.
because, if a vessel within the penis is blocked and they're not able to get an erection,
Hmm.
that may be a sign that there are other arteries in the body that are blocked as well.
Absolutely.
And so,
Absolutely.
right.
Sorry. Yeah.
And so that's what, right. So just exactly what you had mentioned, taking a look at other symptoms and other areas of the body and what other disease processes are going on that may be causing the same issue elsewhere. So I know that you had also talked about, female arousal and libido. And how much of that often do you see? And, do you recommend? Well, actually, what would you recommend for somebody like that? Would you recommend like a coaching or counseling or psychiatry? What do you normally do for somebody?
So it's a combination. So if
Uh-huh.
if it's a lot of psychosocial issues, then I would definitely recommend counseling. And then because usually there's no structural anatomical problems going on there. If there is, and then I mean, even in the case of like a trauma or if there was a rape and all that, because we do get that as well. A lot of times they will go to the ER to do, the rape kit and all that.
Yes. Mhm.
But when the patient comes back to see us and just kind of see if structurally things are healing okay. But a lot of the times, because there's just so many layers to it, I definitely
Yes.
recruit assistance. So
Right.
structurally make sure everything's healing okay, and then like I said, um, make sure that the psychosocial part of it is being taken care of, and then if there's anything else that can be done, obviously if there's any infection from that trauma, making sure that was treated. So there's a lot of layers to that, but I definitely recruit help in those kind of situations, absolutely.
Right. I mean, like you mentioned, there's definitely a lot of layers there, definitely a lot of trauma. So, absolutely, you probably need a lot of people following up with the patient, making sure that she's doing okay, and, long term effects as well. So, definitely. I'm just wondering also, now you had talked about taking care of the patient, from the inside out. So, we know that the exam is, a lot of times what people refer to, but from the inside, are you also, is it that you're checking blood hormone levels, or when you mention, taking care of the patient from the inside out? So maybe you could elaborate on that a little bit.
Okay. So when I say that, I mean, there's definitely layers, there's an exam and all that, but I'm actually talking more about how they're feeding their mind. So, for
Hmm.
example, with the mind portion, when I say mind, body, and soul, um,
Yeah.
talking about, are you getting me time? Are you taking
Hmm.
care of your time? I mean, taking care of yourself. Because I find
Right.
that a lot of women wear a lot of hats. We're
Yeah.
mom, we have jobs, we're entrepreneurs, we have partners. So what I find is, yes, there's a lot of hardcore things that go on structurally, anatomically, but a lot of the physical manifestations can also just come from psychosocial issues. So I do talk to my patients a lot about, hey, are you taking time for yourself? When is the last time you literally just took the day off or took half a day off for yourself? You know, the other thing is, who are you surrounding yourself with? Because that's very important. If you have people around you that are sucking up your energy, after you've spent time with them, you feel drained, that's not a good thing, because that, first of all, can affect you in so many different ways, can get you anxious, depressed, or even stressed out. It can affect your
Right.
sleep. So there's tangible and intangible effects from just something as basic as that. So when I'm talking about that, like as far as the mind, it's things like, are you taking time for yourself? Are you surrounding yourself with the right people, people that build you up, people that invest in you
Yeah.
mentally? The other one is, self development. Are you, learning? Are you putting yourself in situations where you're building yourself up mentally? You know, for example, for us, we're in the
Mhm.
medical field, and we do pretty good at keeping up with medical information. If you're, an accountant or a nutritionist or an engineer, are you feeding your mind on, your said topic? And then on top of that, are you feeding your mind on other things to improve yourself in other ways? Um, and-
Sure.
yeah, right. And then the other thing is, what is your personal radio station playing? And by that, what thoughts are you filling your head with? Are you having, positive self-talk, versus are you telling yourself, hey, I'm not able to do this, I'm not doing well? So that those kind of, and I talk to patients about that, because a lot of times when I'm asking questions, you can tell when a lot of the times, the self-talk isn't what optimal, what it should be. And those are very important, because to me, our voice is the most influential. So if all you're telling yourself is negative things, then you're guaranteed to have a bad day. Um,
Right.
yeah,
Absolutely.
guaranteed, guaranteed. So that's when I say that. That's the mind piece. The body piece, we talk about that, but it's things like, are you, nutrition? Are you feeding your body right? The high protein, lots of veggies, low carb. Are you avoiding the simple starches? Things like, I don't know, donuts, cookies, the things that are low in nutrients and, are not really what you want to be feeding yourself, versus, the good starches like your Quaker oats or your potatoes, that kind of stuff. The other piece of the body is hydration. Are you drinking enough water? Water is a big one. So I tell them 80% of the time you should be drinking water. Um, and then exercise, are you moving your body? So the recommendation is, an hour a day, 5 days a week. But I tell people, come as you are. If you could only do 15, 20 minutes, better than nothing.
Yeah.
Right. And then sleep.
Mhm.
Are you sleeping well? The recommendation, experts say 7 to 9 hours. And this one is a big one. A lot of people don't sleep well. Um, I don't know if it's the technology. People are busy. I mean, we all are. So it's a huge problem. So I talk to people about sleep. I also let them know, if you're not sleeping well, you tend to crave sugar the next day. Oops. Tend to be stressed out, all of that. And so that's the body piece. Now, soul is, meditation, prayer. For me, I'm a Christian. So, but it's whatever that means to you, right? So that feeds your soul. I feel like that grounds you. I wasn't doing it as well as I should have, but definitely recently I've been doing that more, and I feel so much better. Um, and then even spending time with your loved ones, I feel like that feeds your soul as well. So when I talk about that, that's what I talk about. That's what I mean. Yeah.
Yeah, that's amazing. I love that. I love that whole person approach, because that's so important, right? It's easy to go see your doctor and you tell them, here, I'm having this, one symptom. I just need you to take care of this, and they give you a medicine, and then you walk out of the office. But it's another thing to find a doctor that actually takes the time to go over everything, and to go over, your mental health, your physical health, but also your spiritual health. And so I think that's amazing that you do that in your practice. I think that's probably very fulfilling for both you and the patient, and they probably feel like they're really being seen and heard. So I think that's really amazing. And, I wish that more physicians had time to do that, right? Oftentimes, especially when you're in a practice where you have to see patients every 15 minutes and you just don't have that kind of time, right, to spend with the patient. But when you're able to offer concierge medicine like this and, be able to tailor the way that you see a patient based on what their needs are, then I feel like that really is what we were meant to do, right? Is to spend that
Absolutely.
kind of time and energy on the patient so that they feel good when they come see you and also feel good when they leave your office. So that is amazing. It
Absolutely.
seems like you put a lot of coaching into your practice. So I
Yeah.
like that.
Funny thing is, I didn't even see it that way, but yes, I do. A lot of times patients tell me that they're like, man, this was a great session. And the thing is, I'm pretty busy as far as scheduling, but I feel like you have to make the time for that. So a lot of times I will fit it in with, based on what the patient needs. Sometimes
Yeah.
it's not easy to do, but it really, really makes a huge difference. It really does.
Yeah.
So yeah.
Yeah, I'm sure they probably really feel seen and heard when they're, at your office. I think that's
That's
amazing.
cool. That's cool.
Um, so when you had talked about, maybe we can just talk about this really for a little bit. When you
Sure.
talked about the soundtracks, right,
Hmm.
playing in
Hmm.
our head,
Absolutely.
maybe you could elaborate a little bit on that.
That is a big one. That is a big one. And I
Yeah.
would say, even personally, I would say that it wasn't always the case for me staying, positive. So you obviously being optimistic. Um, but over time you just realize that how important it is. I've been reading more about it, and I find that I was thinking I find that with the positive thinking, it affects everything. If
Yeah.
you start your day in a negative mindset, and I think part of it is because I see it a lot in patients.
Yeah.
So if you start your day, like, when I ask a patient, how's your day going? And, they list all the negative things that have happened. Then the question then becomes, and I say this also with my children, did you have, a bad 5 minutes? Or did you have a full bad day? Usually it's you had a bad 5 minutes or at most a bad 20 minutes, but you carried it through for the whole day. And then it's a bad day and the whole day is wasted. You see what I'm saying? So, and I say this a lot to my children, a lot, is make sure that you're not giving yourself a full bad day because you had one bad thing happen during the day, because it's not a matter of if, it's a matter of when. Things aren't perfect, things are going to happen. So it's how you respond to that, external stimulus. And I love this quote that says, offenses are inevitable, but being offended is optional.
Hmm.
That's a big one for me. So it makes a huge difference. It really, really does. So if you're
Wow.
having a hard time, are you telling yourself, "Hey, this is tough, but I'm gonna figure it out," or I can do this," versus, "This sucks. I can't do it. I'm not able to do this." The mindset and the outlook is different in those two situations. The person that says, "Hey, I'm going to figure this out. I'm going to find who can help me with this," is then going to go forward and look for how to make this happen. Even if it's
Right.
not, they can't figure it out, they'll find that person, versus, "I'm just not able to do it," then you're not going to even try. You know what I mean?
Right, right. Absolutely. And I think what you mentioned there is, really about like a fixed mindset and a growth mindset, right? And how we frame the things that happen to us in our lives and it's really so important. And we oftentimes in coaching, we do this as well, is that, we know that our thoughts, right? Our thoughts will lead to our feelings that we have, and then our feelings will lead to our actions. So if we start with thoughts that are negative, then we're going to have those negative emotions, which are only going to lead to negative actions. And then what the most important thing and what I love about coaching is that we have control over our thoughts, right? And that's what the most empowering thing I think is that knowing that we control it, right? Like nobody else. It's up to us. And it's up to us to change our mindset and grow our mindset, but also that we control it. And so that if the thoughts are not serving us, then we can actually let them go,
That's
which
true.
is
You're in
really,
charge. You're in charge.
yeah,
It starts from
absolutely.
up here, and it's the effect of it starting up here is exponential. So once
Yeah.
you start up here, I mean, it fixes a whole bunch of things. A whole
Yeah.
bunch of things. Yes.
Absolutely, absolutely. And I love what you said. You said, offenses are inevitable, but being offended is optional. I
Absolutely.
love that.
Absolutely.
Yeah.
I found that
Yeah.
quote years ago, and I've definitely stuck by that one. That's a really good
Yeah. No,
one.
I love that. So that is
Mhm.
fantastic.
Me too.
So, for our listeners and our viewers, and if they want to come and get the full body experience that you offer, which I think is absolutely amazing with the mind, body, soul experience. To come see you. I wish you were here where I am. I'd come see you for sure. Um, so if you could tell our viewers and our listeners where you're located so that they can find you. And do you ever do like telehealth? Do you do online?
Absolutely. I was going to say that. So, if you're local, we're in Martinsburg, West Virginia, but we also offer virtual appointments. So, the name of the practice is Apple Valley Family Medicine. Our phone number here is 304-350-1087. And you can also find us online at www.applevalleyfamilymedicine. Well, actually, applevalleyfamilymed.com. And we are actually open 7 days a week, and so have evening hours. So we definitely try to be accessible to our patients. So give us a call or look us up online, and we will be able to take care of you. And then as far as social media, we do have a Facebook. It is the Apple Valley Family Medicine. And then I have a podcast called Weekly Dose with Dr. Ude. So it's on YouTube, it's on podcast, and the videos do actually stream on Facebook as well. So yes.
That's awesome. Well, that is amazing. And there's lots of ways to get in touch with you. And I love that. And I have never heard of a practice that is open 7 days a week, for goodness sake. When do you rest?
We have two doctors and two nurse practitioners at our practice. So we all take care of our patients. So we
Wow.
spread it out for sure. We want to make sure everybody's taken care of so that our physician and providers are okay. So we definitely
Yeah.
cover each other. Yes.
That's great. That's great. Well, that is awesome. And I love it. So thank you so much. And thank you
Thank
for
you.
being on. I really appreciate it.
Thank you.
So, well, we are done here and it's been real and really intimate. And remember, this was not meant to be any type of medical advice. So if you are having any medical issues, please go see your medical provider. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.